Some time ago, I noticed that had frequent urination, especially at night, and I always seemed to have to go. And I was always seeing a doctor. I make sure I take care of myself physically. So I was seeing a doctor, and the doctor did some tests, did the PSA, and noticed that it was above normal. And he recommended several doctors, and I chose this doctor, Dr. Dave, and went to see him. And he did some more tests. He got some results, and he did biopsies. And he's told me ahead of time, based on the fact that I was African American and my age, that there was a good chance that I may have prostate cancer. He did the biopsy, sent them off, and I came back later and got the news that I did have prostate cancer. It was very unnerving, very scary, but he explained my options, and my options were I could have the surgery to remove the prostate, and because of my age at that time, I was over 65, that I could just monitor it and have the biopsies I think starting off every 6 months, and then go to a year and just monitor the prostate to see how bad, if it was spreading or whatever. And the other option was radiation.
Oscar was an excellent candidate for robotic surgery because he's in very good health. He's a very active lifestyle and is an avid bike rider. He wanted a therapy that was going to definitively cure him of his prostate cancer and get him back to his active lifestyle as soon as possible with the fewest risks and the fewest long-term side effects and the fewest impact on his quality of life. So therefore, we discussed his options, and Oscar chose to pursue robotic surgery for prostate cancer.
I went in the day of the surgery, went in at 1 o'clock, and the signing in, the process was very smooth. I mean, they already had a lot of information on me already. They have that admission process, which was very good. So when I went in, I just gave them just a little information, brought me up. Everybody was nice, relaxed me, and then I was prepared for surgery. The next, I had the surgery that night, that evening that is, and the next day I woke up, and the nurses got me up and encouraged me to walk. I walked up and down the hallways, and before I know anything, I was feeling a lot better. I was discharged. They wanted to wheel me down in a wheelchair, and I said, no, I can walk, I can do this. I just how much better I felt within just that one day with the nurses taking care of me. And I left and discharged from the hospital, and I was very grateful for what they did for me.
Robotic surgery for prostate cancer provides several distinct advantages over conventional open surgery. First, smaller incisions, which translates to decreased pain and faster recovery. Shorter stay in the hospital with faster return to normal daily activities, and reduced risk of blood loss and need for blood transfusion.
My friend, my coworker, had the surgery, had prostate surgery, but he did not have the robotic surgery. I don't think it was available at that time. But from my results and telling him what I went through versus what he went through, I can see that there was a big, significant difference, and that it was an advantage to me to have the robotic surgery.
Oscar was very interested in getting back to his active lifestyle, and he was interested in minimizing his risks of side effects and having the least impact on his quality of life. This is where robotic surgery for prostate cancer ended up being an excellent option for Oscar because it afforded all of those important outcomes.
I was riding my bicycle within 7 weeks of the surgery, and that was based on the recommendation of the doctor, 7 to 8 weeks, and of course I cheated till the 7th week. But I took my time. Within less than a month, I was doing the same amount of mileage that I was doing prior to the surgery, with less of the problems that I was having prior to the surgery.